You notice I didn't bring up birth control. I'm not going to. I am, but I'm not going to say it's a therapy. It's not a therapy for this. It's not a therapy for this. I should have brought this up in the estrogen one, so I'm going to bring it up now. Why we don't use oral contraceptives for migraines. Why I'm going to tell you that's not the best idea. Well, if you have migraine with aura and you're taking oral contraceptives, your risks for a stroke go up. Why is that? We know that there's a constriction that happens in the brain during a migraine. We know that there's inflammatory things going on in the brain during that time that could be stimulating your body to want to coagulate, making more coagulant state where your body's going to throw a clot. When you take oral contraceptives, the estrogen that's in there first passes through the liver, gets converted to something called estrone at a very high rate. Estrone is one of your estrogens. You're supposed to have it, but it needs to be in a ratio with your estradiol. If your estrone is elevated, it's going to stimulate something called thrombin. It's basically stimulates your body to want to make more clots. Your body's want to coagulate a little bit more. So if you have the migraine with the contraction occurring with the inflammation, pro-inflammatory cytokines and prostaglandins going on, and then I throw estrone and more thrombin in there, what am I doing? That's a recipe for a bad thing. So just know that I will not prescribe that in the face of migraines. What if it's a progesterone-induced migraine, Brendan, and not estrogen? What if it's that? What's going on with that one? Why not just progesterone, a progesterone-only pill, Brendan? Why not that? Because you're getting the progesterone from the pill, from the progesterone-only pill, that'll help their brain, right? No. The progesterone that's in oral contraceptives is not natural, meaning it is not progesterone. It's a synthetic compound that has molecular mimicry. It acts like progesterone somewhat. It has a similar effect to progesterone, but it does not cross the blood-brain barrier and make allopregnanolone. It does not have any benefit down that pathway. It does not impact the brain in a positive way whatsoever. So that's why we don't recommend oral contraceptives for migraines. Now, some women who take contraceptives will notice their migraines are less. Why is that? You're suppressing all of your estrogen at that point. No estrogen's on board. Your natural biological estrogen, your ovaries are not making anymore. So what you've done is you've managed those spikes and drops of your estrogen that were happening previously. So women who have migraines associated with those wild fluctuations in estrogen, that will help them, but at the cost of a higher risk for clots. If your migraines are more associated with that GABA pathway, the anxiety part of the brain, the GABA aminobutyric acid pathway, birth control is not going to help at all because it's not having the positive neurosteroid pathway being turned on.